Now, scores of South African medical trade union members took their high unemployment rate frustrations to the union buildings. The healthcare workers have slammed government's budget cuts that have led to the problem in the sector. The health department has cited financial constraints for the high unemployment rate among healthcare workers, especially doctors. Now, for more on today's march, I'm joined by Dr Cedric Sihlangu, the South African Medical Association Trade Union Secretary General. Dr Sihlangu, thank you so much for joining us tonight. A sad state of affairs when you have people who are providing or who could be providing such a vital role in our society not being able to do so. How did your march go today?
Evening, Masa, and thank you for having us. Firstly, I must indicate that this was a march of healthcare professionals who are unemployed, represented by various organizations, including Samatu. And indeed, the march went very well. In fact, this was a long-planned appointment with the highest office on the land, the 26th of February being the date that healthcare professionals were going to seek to address the office of the presidency on this matter. Despite the recent developments, it was still deemed very necessary for the program to go ahead and for healthcare professionals to still present themselves to the presidency and deliver their CVs to indicate that indeed we're still here, we are still unemployed, and in fact we've heard the president make pronouncements and we're saying, appoint us now, we want to go into work environment and start saving our people.
Now, part of your demands that you listed in your memorandum also include a call for government to stop cutting corners and employ healthcare workers. As you're saying, that's what your members were saying in the march today. Tell us more about this cutting of corners.
Look, well, maybe we must start here. Firstly, it's an election year this year. So naturally, there's always a temptation from politicians to make all sorts of pronouncements. They'll tell you of figures in the budget that would result in appointment and absorption and this and that. And if you really go into the nitty-gritties, you can realize that these figures are very obscure, and no one is coming out clearly to give a clear, decisive account of how many, of the professionals that are going to be absorbed and so on and so forth. So part of the cutting of corners is to speak to that element, to say, we've heard the pronouncements, but, you got to almost, put your money where your mouth is and want to see the plan. And what the march said today is that we need a decisive plan of action within 7 days, because that will then indicate that really something is being done. Because the temptation, as I've said, with politicians during this time of the year, with elections coming up, is just to give, promises over promises.
How frustrating is that for you, Dr. Sihlangu, knowing that, you kind of have to sift through all this information that you're getting, particularly in an election year? Now, the plight and the problems that you're raising as well, and that your members are raising, like you said, this was a long-standing appointment that you had for the 26th of February. This is a long-standing problem as well. How are you then able to have really clear and concise conversations with government when they will be emboldened with the bells and whistles that come with an election year?
Well, one of the processes that is unfolding now is that we will be sitting in bilateral engagements with the department, particularly the Department of Health, understanding indeed that from the finance perspective, initially there was the issue that there are no funds. And now from what we understand is that the funds have been made available. Now we get to the nuts and bolts of the thing to say, okay, fair enough, the funds are there. How do you then begin to ensure in the most speedily manner, ensure that, the healthcare professionals are appointed? And of course, of crucial importance here is that, as I've indicated earlier, that this march encompasses all, healthcare professionals, dietitians, physiotherapists, nurses and so forth. And some of these categories have had, over 2 years of no posts being advertised. So, what we are saying now is let's get to the nitty-gritties.
Now, when we're sitting with vacancies or positions that aren't even vacant or available for 2 years, and yet we're still having a group of graduates in the medical profession who are entering or would like to enter the job market, I mean, that sounds like it's only adding more to our unemployment crisis at this rate.
Of course, we've seen over the weekend where one of the priorities of the governing party now is that employment is at the top of the agenda, and we welcome that. Because indeed, the country simply cannot move without, the young people who are qualifying, getting into employment, getting into jobs and actually pushing the economy forward. So from our perspective, we deem this to be a high priority for ourselves as well, to ensure that we don't only advocate for those who are already in employment, but we fight to have our brothers and sisters to go into the system to get the employment.
It must be also tricky, to get clear account as well. It was last month, I think in the beginning of January, where we had about 6-7, some reports that went to 800 newly graduated doctors who aren't able to be placed. Now, that number seems to be changing, and, we've got different figures from government. We had the department minister as well, Dr. Joe Pasa, saying that number is decreasing. We had the president as well, President Cyril Ramaphosa, saying that number is being worked on and decreasing, and provinces are going through and doing and taking on extra efforts to place these medical professionals as well. Where are we sitting right now with that number of unemployed doctors who were unable to be placed at the beginning of this year?
To be quite honest with you, the numbers haven't moved much because if you really look at the timeline of it, the announcements were only made about 2 weeks ago and last week from the budget speech. So maybe 1 or 2 provinces might have indicated that they will be, releasing posts, but we haven't actually seen anything tangible that says doctors are going to be actually employed in proper contracts to work, to serve the communities definitively. You might get a sense that some provinces are trying to rob Peter to pay Paul by conjuring some system where they say they'll slash, doctor salary by half and kind of make you work some, shift of half days and so forth, which is very confusing. And I think those are the kind of things that concern us quite a bit, because the reality is for doctors and other professionals to be able to serve this, society properly, they need to get into proper employment. This thing of contracts here and there, 3 months, shift here and there, it's not going to help anybody, because it will assist to just quickly shut up, keep everyone quiet for the next month or so, but the problem is just going to arise in the next couple of months when those contracts are done. Yeah,
sounds like kicking the can down the road. Now, what effect is this having on the healthcare workers who are employed and working in staff shortage conditions? I mean, I'm aware that some medical doctors did join your march as well who are employed, and this also has an effect on them as well.
Absolutely. As I've indicated, this march really was healthcare professionals throughout, doctors who are employed, those who are unemployed, nurses, physios, everybody came together. But also that tells you that indeed the system is under strain. When you want to consider how a doctor really works, in the rural areas, you might find that in a night there are 3 doctors on call. And if those 3 doctors have to attend to an emergency in theater, a life-threatening situation, there's nobody left to attend to another emergency that might come through within the casualty setting. So indeed, that results in very, very poor outcomes for our society, because people are dying while waiting for care. And when you find out where the doctors are, they'll tell you, unfortunately, they are stuck in theater. And whoever is in that casualty needing urgent attention is unfortunately might find themselves in a situation that is very, very compromised. So indeed, the impact on the health outcomes is quite significant.
It sounds like, the example that you were making earlier, borrowing from Peter to pay Paul when it comes to a province level to try and deal with this problem, is also happening on a micro level as well within the hospitals and the healthcare facilities themselves, because now, these resources have to be used strategically to make sure that they try and, do the best service that they could. And in the same breath, we've got all this talk about the NHI. Are we ready for this?
That's a very good question. The reality of the matter is we need a system of universal health coverage. That goes without saying. And our view has always been the NHI is one such solution that could assist us there. The only challenge that we're facing is the current state of affairs leaves a lot to be desired, and it actually deducts or subtracts from the confidence that one might have on the implementation of the NHI, not the law, the piece of legislation that is NHI. That is perfectly fine in our view. The concern that we might begin to have is, are we really going to be able to implement this thing? Despite that, we still believe that the piece of legislation that is currently being proposed is absolutely correct.
Now, before I let you go, some of the list of demands that you made in that memorandum as well, outside of cutting corners, what were those?
Well, the key aspect here is we want government to speed up the hiring of doctors. We've heard the pronouncements. We want the hiring of budget to be sped up. But also, going forward, we don't want a repetition of the same thing come 2025. So what we're saying is the notion of budget cuts in critical areas should stop completely. But moreover, we want government, especially the Department of Health, to then begin to have a proper database, because it actually does know how many doctors are completing medical school, how many doctors are completing internship, how many doctors are completing community service. Therefore, it should not come as a surprise to them on the eve of the year to be that suddenly they are unemployed doctors. We need this to stop, and to stop now.
True that. We do not need a repetition of this come 2025. Thank you so much for joining us tonight and for your insights. Good luck with the industry and all the challenges that you're facing right now. Now, that was Dr. Cedric Sihlangu from the South African Medical Association Trade Union, and that's their General Secretary.